viewers, welcome to an interesting episode on Mepod. Today we are going to discuss mental health, a thorough discussion on mental health, how mental health is, how it came about, how it is, and how even the myths surrounding mental health and how we are going to debunk it. Also, if you've not subscribed to our channel, kindly do so and follow us on all our social media platforms. I'm Miss Grace Oseyeboa, and beside me is Mr. Emmanuel Wadi, a nursing officer, and Mrs. Dorcas Akwawa Benton, who is a physician assistant. So I'm having health personnel beside me today, and we are going to bring the discussion to your doorstep today. So I'll start. So if we say mental health, WHO classified mental health as a state of well-being in which an individual realizes his own abilities and can cope with normal stresses of life. You are able to work productively and fruitfully. And also you are able to contribute to the community in which you find yourself. So this is how we classify mental health to be. So someone will even ask, what is even mental illness? What is this illness that we're talking about? So mental illness, for me personally, I would say that mental illness would be the opposite of the WHO definition of mental health. So if an individual is not able to realize his own abilities and you are not able to cope with the normal stresses of life, if you are not being productive in the community that you find yourself, you cannot work, and the work that you work in, it can't be fruitful, it can't be productive. You are not contributing to anything within your environment or the community in which you find yourself. I would say that that one is a mental illness. Yeah. And also sometimes we say that mental illness is also as the mental disorders. Yeah. So when these disorders, when you having some dysfunctions within your thinking, your cognitive, and your behavior, we classify that one to be mental disorder. So that's when we classify those disorders into anxiety disorders, personality disorders, we having psychotic disorders, and we having mood disorders. Yeah, mood and affective disorders. These are some of the disorders that we having. We having some of the neurological disorders that affect the case. Some of the cases, sometimes we even term them in a local dialect as insober. Meanwhile, these are not insober. There are not any spiritual backings to that. It's just some deformities with the brain, with the neurological functions of the individual. That's why the person is experiencing this. So I feel like mental illness is something real, and it's part of our normal life.
Yes, and you see, there are so many myths when it comes to mental health or mental illness.
Okay.
You see, in our community, sometimes we pinpoint certain people as this individual, look, the way he is behaving, he will definitely have this mental issues.
Yeah.
No, you see, the mental health slogan, the slogan that you always talk about,
mental
it can be you, it can
be me.
You see, we shouldn't, pinpoint certain people as they are the ones who are supposed to get the mental health. Like your definition, you said something. If you're unable to be fruitful, you are mentally unhealthy. If you cannot contribute to your environment, you are mentally unhealthy. The last time I was saying, if you're not even having, a good interpersonal relationship with others, if you're having marital issues, you are mentally unstable. So it's not that, this person is on drugs. So this person is definitely getting the mental illness or this person is mentally unhealthy. No. And not anybody who walks into any, psychological, or mental health facility is a person who is sick.
Sure.
Or the people that we see, outside,
sure.
Wearing, the dirty clothes and all those stuff.
Yeah. So for me to even chip with that, if you go to the mental health facility or the mental health clinic, they don't call them patients. They call them like clients.
You see?
Yes.
Because it's because of them that you are there.
Yeah.
You are there. That's why they are coming.
Exactly.
So please, it's not anybody, people cannot pinpoint somebody, say, hey, this person. No. Everybody can have this mental instability.
Sure.
And the moment you are even hungry, you are mentally unstable. You are mentally ill. So just as our sister said, we shouldn't, say that anybody who walks into any mental health institute or anybody who sees a psychologist, that person is mad, or anybody who throws a temper, we call something temper tantrum, that person is unstable. Anybody at all can have it. So please, we shouldn't, classify certain people. And those who are outside wearing, dirty clothes, if they are on treatment, if their families are able to, grab them, take them to a health facility for them to be given medications, they can be like us.
Yes.
We have so many, public servants who are on psychotic medications. They are doing well.
Yeah.
I know of certain drivers when I was doing my national service. So, and when I was at the mental health unit, drivers comes in for their medication. So imagine a driver from Koforidua Kumasi, Accra to Kumasi. The person is on medication. So mental health can happen to anybody. It's not certain group of people who has it. All of us can be a victim. So we should help each other. We shouldn't have that mindset that is a group of people. The short people, the tall people, no. Everybody at all can have it.
Yeah.
So that's what I want to talk about, the myths.
And also, it's just saying that within every 4 individual, there's somebody battling mental illness. And that one, I think, is very true.
Yeah.
Yeah, it's very true. So it's like mental illness is ongoing within our individual's life and our society.
Yeah. And
that we need to take very care of.
Before my brother comes in, I would like to talk about the causes. Sometimes we say that certain conditions are unknown, but there are certain things that predisposes us. You see, when a child is in utero, that's if a child is in the mother's womb. A lecturer once said that you are what your mother eats. See, when your mother, the last time we were having a discussion on breast cancer, we said smoking and then alcoholism. If your mother is pregnant with you and is on alcohol, she smokes, definitely you have a developmental, abnormality.
Sure.
Your chances of getting, brain issues or disorders is very high. So some of the causes you can attribute it to what was your mother on when she was pregnant with you. That one is one of it. And also when you came out, the upbringing, everything, you get it. So when you grow up, you travel to a place. It's not everything that you'll be given. In life is not fair to anybody. It's not what you want, is what you always get. So the person cannot cope with that. Because when the person was growing up, he thinks that everything was at his or her disposal. Now I want this phone, I'm not getting it. So the person is stressed out. So that one too can call in for certain, mental instability. And also, when whatever you eat or drinks, the drugs that you take in, even some medications that are prescribed, you see, because certain medications, dangerous drugs, some opioids and some pain medications, they are addictive.
Sure.
So when you are on it, they can also cause some kind of, mental instability or mental illness. And then stress. Some of us, we go to work, we don't take leaves. Off days we are at work, leave days we are at work. We don't have time for ourselves. If you're unable to manage these stresses, you have to be able to identify your stressor and then deal with it. You have to develop coping mechanisms to fight these stresses, to be able to cope. So if you are stressed out, you know that I'm supposed to rest. I have to take this day off, to rest, to reflect on what I have done, to reflect on what I will do next. You don't get time for yourself. You're always bombarded with, work and stuff. You'll definitely, have some kind of, tension, and everything will be just haywire a day to come. And also, some conditions can call for mental illness.
Yeah.
When somebody is epileptic, the person is not on medications. Anytime the person has an episode, the person will hit the head. But the person will hit the head. And then head injuries is very important. You see, the scar is, protecting the brain. And then if something happens to the scar, if there's a scar fracture or something, the brain becomes fragile. Every microorganisms can travel to the brain and cause some kind of illness and disorder. So please, if you are like somebody has seizure disorders, please, the family members should make sure that the person gets treatment. And also, if you are not even epileptic or you don't have seizure disorder and maybe you have an accident, you hit the head. You know, surgeons especially are very much peculiar when it comes to accident cases.
Yeah.
They ask, where were you landed? Did you land with your head? See, whenever there's an head issue in like road traffic accidents, they will definitely make sure that they treat that.
Yeah.
So that in the end, you will not develop any kind of mental illness. And then, we have brain occupying lesions. The last time we were talking about tumors and all that. You can have growth with abnormal cells in the brains that will impede on the brain, and that will, distort your way of thinking. And also, please, if you are having a child and you see that the behavior of the child is, some kind of, changing, you should also you should probe to know what is actually wrong with the child. I think some of the causes I will leave if any of us have anything to add up to it.
Yeah, so before we even talk about prevention after the causes, I would like us to highlight some of the signs and symptoms because viewers may be interested. If somebody is affected by any mental health problem or illness, what are some of the things that will exhibit or will show that this person is suffering from such an illness? So just like our sister began with, when you are not able to function normally in the society or in the community or become productive, so you have so many ways that somebody may look like that. First of all, the person is not able to report to work on time. So the person loses full consciousness of time. And then sometimes the person may be able to, may not be able to meet all the personal hygiene needs, may neglect bathing or, grooming. Even though the person may go out, but not properly dressed.
Yes, yeah.
And some even go to the extent of, not dressing at all. To that level, that severe kind of stuff. Some too, they will dress normally, they look sharp, excellent on top, but in a meeting like this, their thoughts looks always out of order. We are talking about food, and he's saying Manchester.
Yeah.
You realize the thing. So sometimes too, the person will be in a normal mood in a conversation, but along the line, then the conversation, her contribution or his contribution shifts out of the terrain that we are on at all. So when you see somebody in such a moment, it can tell you that maybe the person is suffering from some mental, illness. Sometimes, like you mentioned, epilepsy.
Yeah.
I believe epilepsy is also a form of mental illness. So
yeah,
epilepsy,
it's a neurological.
Yeah, it's a neurological disorder. So if somebody is suffering from epilepsy and the person experiences an episode, obviously there will be this jerking movement. It's not normal. If you are normal, you shouldn't be jerking. You may fall down and have some injury and all of that. And some people too, they may be doing some ritualistic
behaviors,
activity. Yes. Close the door, come back, believe that it's not closed. Some people can close their door 14 times before they leave to work.
Yeah. About 20 times within 20 minutes.
So, I don't know if you may want to add any.
So let me add something. Okay, so sometimes if you see anybody, maybe you see this person likes watching football. Saturdays and Sunday, the person doesn't joke watching football. But I see this person Saturday, this person will not be watching football again. Sunday, even if you mention football, the person will be angry.
Wow.
Then you'll be like, there's something wrong with my friend. I need to check up on him. Yeah, and maybe you see, maybe this is my friend. Right now, the person, even if you talk to the person becomes angry, becomes agitated. Like, you don't know what's actually going on. You'll be like, sometimes we just ignore them. That, oh no, this person, or trying to but that's not so. Maybe there's something wrong with the person that we need to check up on the person. Sometimes you see somebody will be indoors, doesn't want to even come out, will be in the room crying. Sometimes some people will be aggressive. Some people too will be, excessive joy.
Yes.
They'll be laughing, they'll be walking, they'll be laughing. Some people can sweep this place, and then they can sweep this place like 20 times. If you see certain things, you feel like, no, there's something actually wrong with this person. Or even if the work the person is doing, something is actually affecting the person to not perform well or not even having any urge or any feeling to go and work to get something. Even sometimes eating, as we said, personal hygiene, the person will ignore them. They doesn't see anything wrong with all these things that are happening. They feel like it's okay because maybe there's something that is ongoing that they are thinking about that. So whenever we are in the house with these people, we need to always check up on them. That's why I always say check up on people because you might not know what's happening. Because right now, the way a lot of people are going through a lot. We are all going through a lot.
Yeah.
Sometimes some people, they cannot cope with the stress, and it becomes something else for them. So we need to be checking up on people very much.
And also, you see, sometimes, some people, whenever you are talking with them, they have this thought block.
Yeah.
Like they are lost in the conversation.
So.
And they don't know what to actually, it's like, okay, then it's not said, the person is, thinking of what you were saying, but the person is absent. You are thinking of an eye. The person is not with you.
Yeah.
And also, you are in the house with your, normal days. The person will be like, I'm tired of life. Please, you shouldn't ignore.
Yeah.
Because sometimes whenever, especially the guys, you see, they will be laughing at the person. The next moment, the person has committed suicide.
Yeah.
The person is like, sometimes we could say that, this lady, Dorcas is always like, she's normal. What is actually her problem that she should commit suicide or something? It's because this thing didn't have that he wanted to, but it has started already.
No.
You've been getting the signals, but you didn't pay attention to it. So whenever we are in a house with our children, sisters, whatever they say should be taken serious. And if somebody will say, me, I will kill you. Me, this thing, me, I will kill you. Please. The person can commit homicide.
Yeah.
Well,
Somebody will be dead.
Yeah.
So please, we should also see these things and then report. Or
I think I need to chip in with something. You see, sometimes you be in you be in the house and somebody will be like, you stole my things, you were a witch, you are this.
Yes.
The person be accusing you of something. Something that we shouldn't take it light. We should try and seek help for these people. There's something that's ongoing there, and sometimes with especially these things, it happens to females. You see this person is not big, it's not fat, but the person be like, no, I'm big. I will not eat.
Yes.
Then they will be restricting themselves of food. Some people will even eat and will go and peck the food out.
Yes.
And some people too will be eating non-nutritious food. The person is not pregnant, but yesterday you see the person eating stone, eating sand, and eating some non-nutritious food.
Yeah.
All these are some of the symptoms that if you see the person exhibiting, you could see that no, there's something wrong, and you approach the person. Either you go to the hospital or you try anything to help the person so that the person will get any solution to that.
Yeah.
And just last week, I just had a 13-year-old boy had committed suicide. 13
Wow, this is very, very
13.
Yeah.
Maybe before you know, there's something that was ongoing in the house that everybody ignored. Maybe there were signs. There were definitely some signs that people ignored.
And then, too much reservation. Some people, all of a sudden, you see them reserved.
So
They are this open type, social people.
yeah.
They go to club, watch, go to the cinema, watch movies and all of that. But all of a sudden, a few weeks ago, you see the person indoor, not eating, neglecting social grouping and all of that. This could be a sign that something is. And then some abnormal hearings or seeings.
Yes.
I heard that so and so. Meanwhile, it is not a normal thing at
It's
all.
not even paranoid. They say that, are you talking about me? It's like, maybe
They always believe that somebody is doing wrong.
And also those that will be like, I'm hearing voices.
Yes.
I am God. I created heaven.
Yes.
Sometimes I be like, oh, Nipa will join in. Sometimes you will join in no more.
But
Sometimes
dressing,
wrong with
yes,
this
but
person.
dressing, people put on jewelries, you know.
Yes.
I even heard that some even can put, the chains in bags on their necks.
Yes.
Yes.
Some people wearing colorful dresses.
Yes. Some
All these are some signs that whenever we see no, there's actually something wrong. But sometimes we will say that if it just happened once, twice, it's okay. But if it's continuous, persistent for more than 2 weeks and above, so you're seeing all these signs, then you need to click you that there's something wrong with the person. The last time I think at the facility, we had somebody that came, the person was like, I am Jesus. If you call the person with the real name, what the person will do, the person will hit you with something. But you have to call him Jesus. I am Jesus. Yes, I am Jesus. You see, some people, I think the last time at the entrance of a hospital, I met one man. He was saying that God has sent him to come to the hospital to tell the doctors that God has given them some powers to come and heal the sick, so they should grant him the permission to come and heal. All these things are some of the signs sometimes we see we shouldn't ignore.
So looking at all of these issues, I want us to figure out how we can prevent them.
Oh, okay.
So I like your approach coming from the womb. There are so many things that we can prevent. So you mentioned certain medications or drugs, abuse or substances that pregnant women may use that may have issues with the baby.
Yeah.
So if a pregnant woman takes in a lot of alcohol or smokes or takes in some substances that are not, prescribed, it could lead to development of abnormality when the baby is born. And that could be the leverage from where a mental illness or neurological disease could come from.
I think when it leads to the FAS, the alcohol syndrome, the fetus alcohol syndrome, when it leads to that, you see the brain is not able to form well. So it predispose the kid to certain mental condition due to that reason.
Of course. And there is this abnormality, hydrocephalus.
Yeah.
When the head is abnormally big in the baby, it can lead to, seizures and all of that. So we are advising our women that when you are pregnant, let's eat healthy.
Yeah.
Let's stay away from substance used or abused.
That one is,
when someone is pregnant, they go in for NMS, almost like
this herbal concoction.
It's very
so
it's very, very harmful to the fetus.
Yeah.
So they should try as much as possible. You stick to the drugs that we've been given at the hospital. Some also combine the two.
Yeah.
Please don't combine medications. If you are dealing with the ones in the hospital, do. And even if you want to be on herbal medications, you have herbal doctors in the hospital.
Yeah.
When you are sick or when you are pregnant, you want to go for, herbal medication. They have prescribed medications for you.
Yeah.
So please, even if you want herbal medication, go to the hospital. They will direct you as to where to go to get it.
Yeah.
So please, the NMS is getting too much in the system.
Yeah.
It creates abnormality.
Yes. Preventing mental illness or mental health problems is multi-stakeholder engagement. The government even have some section of a role to play because the stresses, you mentioned stresses. The stress in the economy and the system also exposes a lot of people, especially the youth, to indulge in certain things that predispose them to mental illness. So on that side, you can see that when the society is formed to be free of some of these stresses, the youth will stay calm, feel fit in the society. They will go to school, they will become productive, and they will think of any deviant behaviors.
Yeah.
But when they want to do this and it is not picking up, they want to do that, it's not picking up, they will involve, their peers will give them the pressure. That's what we call peer pressure. Then they will involve themselves in certain things like drug use and all of that. That can lead to that. With this note, I want to advise the youth. Substance abuse is one of the greatest factors leading to a lot of mental. I heard of this thing you mentioned.
Red.
225.
Okay.
I don't know. It's tramadol, right?
Yes.
225. Tramadol is normally prescribed. 50 milligram, 100 milligram. It's fine. But when we take 225,
Yeah.
and the 225 is one tablet for that form of red. But people take more than one tablet. You know that the number of tablets you are taking of 225,
More than people.
like thousands, and so milligram, is not nice. Me as a nurse on the clinical field, I've seen a lot of people rush to the emergency because they were given they were offered some drink under a program which had or contained some form of drug that the person didn't know. And the first exposure or contact with such a substance, ignites some form of mental problem or ailment. Then the person is brought to the hospital. Sometimes the person collapses. Sometimes the person becomes disorganized or confused and all of that. And we are advising the youth that we should desist from all of this. And the last thing I want to add, maybe before you come in, is that we should also know that, like you said, it's not everything in this world that you wish that you would get.
Yes, that's
So sometimes we are not saying be complacent in life with whatever you've gotten, but also be content with the little you have whilst you fight for more.
Yeah.
The fact that my sister is driving a Range Rover doesn't mean I should also. If I give myself that pressure, I will go and do certain things that I'm not supposed to do. So let us stay, calm. Believe that you can make it.
Sure.
Don't feel pressurized. Otherwise, it will send you elsewhere.
Yeah.
Sure.
I think before we add the management and end, for the prevention too, we should try our possible best to approach our friends, our loved ones, our brothers and sisters. Whenever we see any changes with them, approach them. Let's talk to them. Maybe they need us in any of these things. Maybe we can help them. Maybe at that mild stage, we can help them to stay out from that mild stage, not to get to the extent that we can't even control anymore.
Yes.
And also, parents, I was talking to a friend. He said, a parent, you are the prophet to your child.
Yeah.
You are the teacher, you are the friend. Don't wait for your children to pick friends from outside.
Sure.
Whenever your child goes out and comes home, you should involve your child in the conversation. Oh, school, what happened today at school? Create that atmosphere with your child as the child is growing up. That is when, if the child is having any difficulties in life, he or she will feel free to come to you.
Oh, okay.
Most of the times we are parents to our children. That's it. We are not friends. We are not praying for them. We are not doing anything aside being parents. So please, the first friends that your children should have is you, the parents. Get closer to your children. Get to know their weakness. Get to know what they are interested in. Help them to come up with whatever their abilities are. That will help them for you to even detect if there is an abnormality in their behaviors. You will be the first to pick, not their friend. Sometimes, even if their friend sees it first, they will not even come to you.
Sure.
Because you are not approachable.
Yeah.
So please, parents should be friends to their children to help to prevent mental illness.
I think we should discuss some of them.
Yeah.
Ending with the management. It's also broad and multi-stakeholder, engagement. First of all, family support. When somebody develops some mental disorder or neurological disorder or mental health ailment, the family is needed. Yes, is the main stakeholder who needs to involve in the care. Because, for instance, if you come to the hospital and we do our part and the family neglects you, it can never end anywhere.
No.
So the family support involves any other thing like the social care, the emotional support, the financial care or financial support and all of that. In that, we shouldn't stigmatize all of them. Stigma is one of the greatest challenge to mental health care delivery.
Sure.
Yes, because, and that is what makes people
Yeah.
take away their life.
That's why some of the family members, they even neglect their...
Exactly. Because mostly we attach entirely spirituality to mental illness as its cause. Meanwhile, we don't underestimate that spirituality is real, but we also believe that health is different and not everything is spiritual. So if something is wrong with your family member in terms of mental health, it is not the time that you have to say the person is in sober or the person,
Yes.
the person is harboring the family cases or something like that. And for that matter, you don't want to do anything with the person, but drawing close to the person, providing the financial and the emotional support, will help. Yes. And also, I will also come back to the government, because if the government do not put up a very good and accommodating healthcare structure for these people, what else can we do? Because the hospital should also have that environment to help. And it is hugely influenced by the government. When it comes to Ghana, it is in Ghana that we see a lot of, sorry to say, mad people on the road. But in the European countries,
the vagrants on the road, because their treatment is expensive. You go to the hospital a month, you're paying 4,000, 3,000 for a month. Your family, they are not working. They can't afford.
Yeah, it's a challenge.
So that's what will happen.
Sure. And then nutritional support. Somebody must prove to the fact that somebody suffering from such ailments is well, fed. The person is not, neglected in terms of what to eat in the morning, in the night, or in the evenings. So we should also have that kind of nutritional support in mind. So these are some of the ways that, and antipsychotic drug, medication.
Have medication.
Yes. Mostly taken at the hospital. There are so many ailments that is on the road that a single medication can let the person come back to home.
Sure.
Even though some may be expensive, but when given, people become well.
Yeah.
We are encouraging the general public that if somebody is suffering from some mental illness or any form of, diseases, even bedwetting.
Sure.
There is a medication that we can give so that bedwetting can be managed.
Sure.
Bedwetting is not spirituality or spiritism. It's a mental problem that can be treated at the hospital. So we want to encourage our general public that these things are also solved at the hospital. We shouldn't stigmatize. We shouldn't over spiritualize. We should come to the hospital and add family support to it. Sure.
Yeah, and I think we should also plead with the government to come in aid with these people, those battling with mental illness, to help them subsidize their financial costs for them as well. Any final words, maybe we end?
Yes, my final words are that mental health is most underrated in our system here in Ghana. But for me, it is one of the most important aspects of health that we must all pay attention to.
All right.
And also mental health, so that, as my brother said, we shouldn't over spiritualize it. And then we should always seek treatments for anybody who is having abnormal behaviors. Thank you very much.
You're welcome. Thank you very much for joining us for this discussion. Thank you all our viewers for also watching with us today. Kindly subscribe to our channel if you've not so, and also kindly join us or follow our social media platform. Please, mental illness is real. And also, it could be you, it could be me. So let's all stay vigilant and take good care of ourselves and our health too. Thank you very much for joining us today. Bye.
Bye.
We are possessing the nations all over the world. The Lord will be our strength. Strength to preach the word in all the world. Strength to live the word in all our ways. We are possessing the nations